Hello, everyone, and welcome to my very short presentation on a very important public health and community health topic, and it would be on the resurgence of sexually transmitted diseases. I am Simone Pierre, and I will be the presenter for today. So before we talk about the resurgence of sexually transmitted diseases itself, let's talk about what are sexually transmitted diseases. Let us talk about the facts. So one of the things that you would need to know is that sometimes we also refer to sexually transmitted diseases as sexually transmitted infections. So you may see it written either way, and you may also see it written as STDs or STIs. And what that basically means, STDs, sexually transmitted diseases, these are infections that pass from one person to another through vaginal, oral, and anal sex. There are some instances as well where sexually transmitted diseases or infections can pass from one person to another. That would be from mom to baby, and this can happen during pregnancy, during childbirth, and can also occur during breastfeeding as well. So STDs, importantly, what is a very key point is that they do not always cause symptoms, or the symptoms may be very, very mild. And what that means is that sometimes persons can have a sexually transmitted infection and they do not know. So that's why it's important to get tested all the time. Persons that do, however, show symptoms, sometimes the symptoms can be vaginal discharge, urethral discharge. They can also present with burning or some uncomfortable sensation when urinating, as well as things like abdominal pain, right? But if you do receive a positive sexually transmitted disease diagnosis, it really isn't the end of the world, because very importantly, and actually fortunately, all of the sexually transmitted diseases that we know about are treatable with medicine. And what that means is that they are not all curable. There are some that are curable entirely, but and there are some of them that are not curable at all, but all of them are treatable. And what that means is that you can treat it with medication for the patient to feel better, and the patient also to decrease the chances of going to some of the complications that can come with sexually transmitted diseases. So let's move along. So let's actually talk about the resurgence now, what we mean by resurgence. So resurgence just basically means that there is a rise or an increased number or increased rate of sexually transmitted diseases as compared to the trends that we saw in years before. And this has been reported in the US, this has been reported in the UK, this has been reported in Russia, this has actually been reported almost in every continent. They're seeing an increased number of cases over the last few years. And what is causing this resurgence, as we say? And this is actually something that's happened before the pandemic. Yes, so years before the pandemic, up to 6 years before the pandemic. And that is because, right, the CDC is actually citing that that is because of reductions in STD screening, reductions in treatment, prevention, and partner services, right? And if based on the STD surveillance report from 2019, we actually see that there was a 19% increase in chlamydia, 56% in gonorrhea, 74% in syphilis, and a 279, and that is the largest increase that we've seen in congenital syphilis. Yes, so these are the trends that we're seeing all over the world. And additionally, with the pandemic, there's even more reduction in some cases with STD screening and treatment and prevention, because a lot of the resources and efforts were placed in curbing the COVID-19 pandemic. So I am pretty sure, and it's safe to say, and even with the trends and the readings, they are predicting that when the new STD surveillance paper comes out, or report comes out rather, we will see even more increased rates and numbers of these sexually transmitted diseases. So it's a problem, all right? So who are the persons that are most affected by this resurgence of sexually transmitted diseases. In general, everyone is affected. Of course, everyone is affected. But there are some groups that are more at risk, and there are some groups that are more vulnerable, right? So definitely your marginalized groups of or group of or population groups are going to be the ones that are going to be most affected. People of color actually, from blacks to Hispanics, well, to non-white Hispanics, as well as, you know, Pacific Islanders and Native Hawaiians, they have an increased, sometimes up to 2 times, some of the populations 3 times, sometimes even 4 or 5 times, up to 8 times, actually in African Americans, higher rates of sexually transmitted diseases than the persons of a Caucasian race or ethnicity. In addition, young people, and when we say young people, we mean persons from the ages of about 14 and 15 to 24, 25, they also have an increased risk of sexually transmitted diseases. And they actually take up very close to half of the cases of chlamydia and gonorrhea. And gay or bisexual men also increased risk again. And they actually take up, from the CDC, from the CDC, it's been reported that gay or bisexual men actually have a 42 times higher rate of gonorrhea compared to heterosexual men. And of course, other marginalized groups, for example, sex workers, persons that inject drugs, people that are highly mobile, meaning moving from one place to another, prison inmates, these people are also additionally very, very vulnerable and high risk for sexually transmitted diseases. Why do we care? So STIs have a profound impact on sexual and reproductive health. Not just the fact that you have the disease and the symptoms that come with the disease, and the sickness that comes with the disease. There's also stigmatization that comes, and discrimination in some places that come with sexually transmitted diseases as well. And in addition, some sexually transmitted diseases can increase the risk of you getting other sexually transmitted diseases, such as HIV. There can also be mother-to-child transmission of STIs, and that can result, as we talked about before, and that can result in stillbirths, neonatal deaths, low birth weights, prematurity, sepsis, pneumonia, a lot of different things, right? Things like hepatitis B actually resulted in about over 800,000 deaths in 2019, because hepatitis B is one of the things that can cause liver cancer, right? HPV infection causes cervical cancer. That's a well-known pathology that we know about now. And in case we didn't know, or some of us don't know, cervical cancer is actually one of the leading causes of cancers and the leading causes of cancer deaths in women, right? And certain STIs such as gonorrhea, chlamydia are actually major causes of pelvic inflammatory disease, and that can actually cause infertility in women. So what can we do, right? Of course, individually, you want to get tested. You want to know your status. Knowing your status is your best bet at getting yourself treated, right? You know your status. If you do have a sexually transmitted disease, then you go for treatment. And as we mentioned, all of them are treatable. Some of them, thankfully, are even curable. But we want to also talk about how can we prevent ourselves from getting the sexually transmitted disease in the first place, right? And we talk about condom use, proper condom use of latex condoms, right? There are also sexually transmitted diseases that have vaccines available. For example, your hepatitis B and your HPV has vaccines available. And then on the community level, of course, we need to have interventions. We need to beef up, as we say locally, our sexual health education campaigns. We cannot falter at any point in time. We need to, of course, have accessible and affordable healthcare. That's a whole topic on its own, right? But persons need to know that they can get tested. We need to have places they can get tested and can get treatment, and it can be done where everyone can afford it. Right? And of course, research, and that's not necessarily on a community-based level, but internationally, there's been a lot of advancement in the research area for vaccines for things like herpes and HIV. All right. So that's basically the end of the presentation. Very, very short. Just wanted to give you the basics, wanted to kind of, you know, jog your interest and pique your interest to kind of go and research this on your own, see that this is an issue within our communities. It's happening presently, and just kind of get the ball going on how we can have these conversations and address this problem, right? So if you don't go away with anything, I want you to go away with this, right? This, you could take a picture. This basically is my presentation in a nutshell. I could have just used this and did the presentation, right? So the very, very simple concept now. So thank you very much for listening. I thank you very much for participating, and I will welcome any questions on my presentation. Thank you.